Hello and welcome back. In this lecture, we're going to talk a little bit about the therapeutic lifestyle diet, which will be abbreviated TLC. And this is a dietary approach that we use to help people who have heart disease. So today we're going to talk a little bit about, with regard to heart disease, okay, what are the modifiable risk factors over which one has control? Because there's not really anything you can do about the non-modifiable risk factors, but we'll differentiate between the two. I'll introduce you to the basic concepts of the TLC diet, and then we'll focus on, for the most part, on saturated fat, because that's the area where we can make the greatest inroads. And then we'll talk a little bit about eggs and cholesterol, because there's some misunderstanding about the role of dietary cholesterol on blood cholesterol levels. And we'll finish off looking at niacin as a dietary supplement for high cholesterol levels. So starting with cholesterol. Okay, you've seen the commercials about different drugs that say, we treat the two things that elevate blood cholesterol levels, your family and your lifestyle. Okay, and so we can treat cholesterol with drugs, but also with lifestyle. And what's cool about the TLC approach is that this is really great for patients who are motivated to not go on statins or other medications for their high cholesterol. If they want drugs, they're probably not going to try the dietary stuff. But there's a good percentage of your population out there who's going to say, no, hold off on the prescription and let me see if there's anything I can do on my own to help lower my blood cholesterol levels. And the TLC diet is going to work for these guys. Okay, so what are our ultimate goals? We don't want to get too hung up on numbers because there's a rough estimate out there that approximately half of all people who have heart attacks have normal blood cholesterol levels. So just because you get your blood cholesterol levels into the quote-unquote normal range does not protect you from the effects of heart disease. But if you're looking at different metrics for which to track positive outcomes, then we look at goals such as blood cholesterol levels. And we're looking primarily at an LDL cholesterol level of less than 100. Okay, we used to say less than 130, but really the American Heart Association has kind of paved the way in saying, no, we really want for people that are at risk for heart disease to have their LDL level less than 100. Okay, we're also going to talk about triglycerides later in this module, and our goal there is going to be less than 150. So when it comes to the risk factors, we have modifiable and non-modifiable risk factors. The non-modifiable ones are the things that are going to put you at risk and you have no control over them, right? Your heredity, if you are in a family where there's big, large numbers of people that have heart disease, there's a greater chance you may have it. Your age, as you age, of course, your risk goes up and you can't change that. And then your gender, okay? Heart disease still is the #1 killer of both males and females, but males are at greater risk for developing heart disease. On the other side of the slide, though, you see the modifiable risk factors. And these are the things over which we do have control and the areas where we do need to be helping our patients or at least providing information that can help them. And those are changes to diet, to reversing the effects of overweight and helping people achieve and maintain a healthy weight. And we do that also through the inclusion of physical activity. So let's look a little bit and break down these modifiable risk factors to see where are the areas that we can make recommendations in line with the therapeutic lifestyle change approach to controlling high cholesterol and heart disease risk. And we're going to start with overweight, okay? Overweight, sometimes for some patients, they don't make the connection between their weight and their health. Okay, to you and I who work in the healthcare field, that's a no-brainer. Okay, you're overweight, it leads to all sorts of chronic disease risk, but there are some patients for whom this might be new information. And so it may help to start with a conversation of, do you know what the effects of being overweight are on your heart? Okay, excess weight raises your bad cholesterol levels. It raises your triglyceride levels. It lowers your good cholesterol levels. And losing weight can be an quote unquote easy way. Okay, of course it's easier said than done, but can help lower LDL and triglycerides and help elevate HDL levels as well. Now, physical activity, that's another modifiable risk factor. Physical activity contributes to overweight, also raises LDL and lowers our good cholesterol levels. So regular physical activity can help you reverse those to raise your good cholesterol levels. It's one of the very few things you can do to raise your good cholesterol levels. In this module, we're going to talk about all the different things you can do to lower your bad cholesterol levels. People say, well, fine, but what can I do to raise my good cholesterol levels? There's a very short list. You can exercise regularly, okay, or you can include moderate amounts of alcohol. Okay, when we talk about moderate, that's the equivalent of 2 drinks per day or less for men and 1 drink per day or less for women. Okay, and we'll talk about what a drink is a little bit later, but it's not a reason to take up drinking. If you don't already drink, don't start adding alcohol because you're really only going to see, a very few points increase in your HDL. Okay, there's not a whole lot you can do to raise HDL, but there is a lot from a dietary standpoint you can do to lower LDL, and that's what we're going to focus on. From diet, okay, the Focus here, if you walk away with nothing else from this lecture, the number one area in your diet where you can make changes to lower your LDL level is by reducing saturated fat. Okay, and that comes as a surprise to a lot of patients because they think literally, oh, I have high cholesterol, I should stop eating cholesterol. No, it really doesn't matter. The dietary cholesterol in your diet has a very moderate effect on your blood cholesterol levels. But the saturated fat in your diet, okay, for decades now we've known that that really is the area we want to focus on. And saturated fats are found in solid fats, which are found in animal fats. Okay, we also find saturated fats in things like coconut oil and palm kernel oil. We'll talk about that a little bit later, but the most saturated fat in the US diet comes from animal foods. The less animal foods we can get our patients to eat, the more plant foods we can get them to eat, the better we are doing for their LDL cholesterol levels. Okay, trans fats also raise LDL, but to be honest, since 2006, when trans fats were made to be put on the food label and Americans started paying attention, manufacturers have really removed the good majority of trans fats from the diet. So we don't want to focus on something that's really not the primary problem. Yeah, you shouldn't eat hardly any trans fats, but most people can make inroads by reducing their saturated fat. Okay, cholesterol, there's a moderate effect. Okay, some people are particularly sensitive to dietary cholesterol. Okay, but if you had to rank these three, number one most important for people at risk for heart disease, cut out saturated fat. 2 and 3 would be trans fat and cholesterol. Okay, keep in mind that cholesterol is only found in animal foods. So when you see things like signs that say, our French fries are only fried in cholesterol-free peanut oil, who cares? Peanuts never had a liver. They never made cholesterol to begin with. They're not an animal product. You would never get cholesterol in peanut oil. Okay, now you're getting a bunch of fat and excess calories and you're eating French fries. Okay, that's not good for a number of reasons, but cholesterol is only found in animal foods to begin with. The less animal foods we can eat, the more plant foods, again, the better for heart disease risk. So let's get to the meat and potatoes of the TLC diet, okay? Now, this is a diet that is backed up by research. If you search the U.S. News and World Report best diets, okay, and that sounds kind of like an odd recommendation, but it's actually a really great resource, especially for consumers, because every year when the best diets list is put out, it's put out by a panel of very impressive people in the food and nutrition community who have no ties to commercial or manufactured foods, and they rank all the fad diets. And the TLC diet, the Mediterranean diet, and the DASH diet, which are all non-commercial diets, basically, always come out on top. Okay, and the TLC diet's really straightforward. Really low saturated fat, moderate fat intake, moderate cholesterol intake, cut back on your sodium, and then there's specific recommendations about calories. Okay, if you just want to lower your LDL levels, then 2,500 calories a day for men and 1,800 calories a day for women. But most people, because 2/3 of our population is going to be overweight or obese, are also going to want to lose weight in order to reduce their cholesterol levels. And if that's the case, then 1,600 calories per day for men and no more than 1,200 calories per day for women. And just as an aside, 1,200 calories per day for women is about as low as you'll ever see a reputable diet plan go. Anytime you're below 1,200, like these kind of silly medically supervised weight loss plans where they're doing 600 or 800 calories, that might help with initial weight loss, but that is not a sustainable way to lose weight. We never want to see less than 1,200 calories. And for a lot of women, most women, 1,200 is going to be the baseline. So does the TLC diet work? Yes. There is research to show that reductions in saturated fat can lower your LDL by anywhere from 8 to 10%. Dietary cholesterol, less of an impact, 3 to 5%. If you're overweight, just losing those first 10 pounds can reduce LDL by 5 to 8%. Increasing soluble fiber by getting an additional 5 to 10 grams can lower the LDL level by 3 to 5%. And then adding plant stanols or sterols is kind of I think it's a liberal reduction, 5 to 15%. We're going to talk about plant stanols and sterols in a separate lecture because it's kind of a tricky thing. And to be honest, it's not really worth the extra calories that you have to add in order to get that effect. So basically, from the therapeutic lifestyle diet approach, if you put all those things together, you can reduce your LDL by anywhere from 20 to 30% with TLC alone and no medication. Okay, that's pretty impressive. I want to do a couple of quick applications just in case you're curious about how you might use these recommendations in a setting where you have a patient who is inclined to actually put some of these numbers into practice. Let's say you have a patient, Barry, and he's on an 1,800 calorie a day diet. Okay, how many grams of saturated fat per day max should he have if he's following the therapeutic lifestyle change diet? Okay, so TLC says no more than 7% of those calories should come from saturated fat. So 7% of 1,800 calories is 126 calories from saturated fat. Now we asked how many grams of saturated fat, because that's what's going to be listed on the food labels that Barry's looking at. And every gram of fat, regardless of what type of fat it is, has 9 calories. So 126 calories from saturated fat divided by 9 calories per gram of fat would mean he should have no more than 14 grams of saturated fat per day. Okay, and if you think about the fact that a piece of cheese, like a 1-ounce serving of cheese, like a slice that you would see at Subway, or it's basically the size of a domino if you're eating fancy cheese, that's 5 grams of saturated fat. Okay, so you go get a foot-long sandwich and you put 3 pieces of cheese on it, that's 5, 10, 15 grams of saturated fat. That's it for Barry for the whole day. So you can see that one of the best recommendations is just cut out or severely cut back on animal foods like meat, cheese, whole milk, butter, dark meat of poultry, etc. So what does that 14 grams of saturated fat look like? Okay, again, 3 pieces of cheese at Subway, 2 tablespoons of butter, 6 ounces of ground beef, or 3 tablespoons of lard, which you might not think you eat 3 tablespoons of lard, but if you eat Mexican food at a Mexican restaurant, I guarantee you in a serving of refried beans, which you think are healthy, you're getting at least 3 tablespoons of lard. How about eggs and cholesterol? A lot of confusion there. Let's say we have a lady named Rita. She's following that TLC diet in order to lower her cholesterol, and she's really cut back on animal products like you recommended, but she loves eggs. Now, how many eggs a day is it safe to have? People ask you this all the time. Well, they actually ask you, are eggs good? Which is a really loaded question because eggs by themselves are perfectly healthy, but think about how most people eat eggs, right? They fry them in butter, then they put them on top of white bread toast, which they probably put more butter on, then they put bacon on top of that, sometimes cheese, and it goes on and on and on. Okay, so the context in which we eat eggs needs to be addressed, but eggs by themselves are pretty healthy. And if Rita really wants an egg, one egg, you should know, has 186 milligrams of cholesterol. Okay, so if she were going to keep within the TLC guidelines, then how many eggs per week can she have if she's really done a great job of cutting out almost all the other animal foods in her diet? Okay, and the answer there is 7. Because if you look back at the guidelines for TLC, you want to aim to have on average less than 200 milligrams a day. Okay, so even if she goes crazy on the weekend and has 3 or 4 eggs on Saturday and Sunday, okay, and has none the other days, she's perfectly fine. Okay, now keep in mind, the cholesterol is found in egg yolk. Okay, so if she really likes eggs and you want to bulk up on the volume, you can always recommend, you do 2 or 3 egg whites per every yolk. But as far as yolks go, she could have up to 7 a week if she's really minimizing the other animal foods in her diet and be perfectly fine. Last thing I just wanted to mention, because I don't really have place for it elsewhere in any of the other lectures in this module, is talking about niacin for cholesterol. Okay, niacin, as you probably know, is a water-soluble B vitamin, used sometimes but almost rarely. Here it's called vitamin B3, which is its other name. Okay, and nicotinic acid, so in its supplemental form, helps improve cholesterol levels. Okay, it's available over the counter and should only be taken under the supervision of a primary care practitioner. Now, niacin can help improve all lipoprotein levels, so it helps improve by lowering total cholesterol, decreasing LDL, triglycerides, and then increasing HDL. When taken in really high doses, it can lower LDL from anywhere to 5 to 15%, and in some cases even up to 25%. But of course we want to be cautious because as with all supplements in high doses, niacin can actually cause a negative side effect, and that's what's called niacin flush. Okay, so anywhere from 1 to 3 grams, okay, that's about 50 to 150 times the amount of niacin you would find in your standard multivitamin, okay, and way higher than you would ever get in food. Okay, the upper limit for niacin is 35 milligrams, so 1 to 3 grams is significantly higher than that, and in some people it does cause flushing. Okay, so how can we avoid flushing? You can try the following. You can take an extended release product, take it with food, so preferably after dinner or bedtime snack. It's also recommended to avoid hot drinks and alcohol when you take niacin for people who are especially prone to flushing. Okay, and then you can also consider aspirin before the meal with niacin, but of course you'd want to consult your healthcare professional first. The last thing I want to leave you with are some TLC resources. If you're interested in this diet, you've never heard of it, there's a fairly decent guide from the National Heart, Lung, and Blood Institute called Your Guide to Lowering Cholesterol with TLC. It's pretty lengthy, but it has the basics of the diet, it has the research that supports it, and then a couple of ideas about meal plans and ways you can incorporate this low animal food diet to help lower cholesterol. And then also, as I mentioned earlier, you might just want to recommend searching US News Best Diets. Okay, this is a report that comes out every January, and it really does a great job of boiling down all the research and telling you why certain diets are good and other ones aren't. Okay, because you can't remember all of the reasons why most of the fad diets out there are terrible ideas. But what I like about this guide is it ranks the best ones too. And you'll find that the most reasonable diets, like TLC, Mediterranean, DASH diet, they always rank very high, usually 1, 2, or 3 on this report.